On to interventions for hypertension or high blood pressure. You can refer to the handout provided for more detailed instructions and an idea of what we recommend at the Burris Clinic for you to do. And always, if you're starting an exercise program, you want to consult your physician to make sure that you're healthy enough to do so. But I do believe at the Burris Clinic we will provide you some simple instructions to start this. So the Burris Clinic teaches you to manage your hypertension in other ways besides pharmaceutical intervention. So here are some strategies to do so. First of all, slowly reduce your carbohydrate intake. Lowering carbs in your diet will help to naturally lower your overall fluid levels, thereby reducing the pressure in your blood. A good strategy to do this, to lower your carbohydrate intake, is to eliminate white flour products such as bread, pasta, and other processed foods with enriched flour, such as crackers, cookies, etc. You can also reduce your intake of potatoes, both white and sweet potatoes, exchanging these foods for increased vegetable intake and meat consumption. You can even count the grams of the carbohydrates you consume daily, with the eventual goal of keeping your carbohydrate intake to 150 grams or less a day. That's one way to start managing your hypertension. The second way is to start a general mobility movement program. This will allow your arterial system to become more flexible and pliable. Yes, when you stretch, you also stretch your cardiovascular system. Having a more pliable arterial system allows it to accept pressure changes more readily, which keeps your overall blood pressure more stabilized. Having a more flexible blood vessel system helps to reduce hypertension. The third way that you can begin to manage your hypertension is to begin a regular aerobic movement program. So not only does stretching improve the pliability of your cardiovascular system, aerobic exercise helps to induce arterial dilation to reduce your overall blood pressure. This can be done through engaging in the conditioning part of a therapeutic movement program, which you can refer to the Movement for Life series that the Burris Clinic has created in order to teach individuals how to start a therapeutic movement program. The link is in the notes. You can also begin a regular outdoor walking program. I usually recommend my clients to start with 15 minutes of outdoor walking at least 5 times a week, working up as you can. You can start a swimming program, a light jogging program if you're at that level. Biking is great. Mountain biking or just road biking is a great way to engage in aerobic conditioning. So the Burris Clinic recommends 3 to 5 times a week aerobic conditioning work at a mild to moderate intensity, which means your exertion level should be at less than 6 out of 10 on the exertion scale, which means basically you're not going to kill yourself during your aerobic movement session. The next way to manage your hypertension or high blood pressure is to begin a regular calming practice, what we've entitled here at the Burris Clinic a nervous system down regulation practice or technique. Relaxing your sympathetic nervous system helps to decrease your heart contractility, which thereby decreases your blood pressure numbers. In our stressful Western society, sympathetic nervous system, or the fight or fight response your body has, tends to be on overload, which can affect your blood pressure levels due to the effects of stress on the whole physiological process, including heart contractility. So starting a neuro downregulation practice will help you to mitigate this excessive stress, which will thereby decrease your blood pressure through physiological mechanisms. You can refer to the video module provided for instructions on how to start a neuro downregulation practice. Starting with 5 minutes, a couple times a week, you can eventually work up to 3 to 4 times a week for up to 20 minutes, making time during lunch, after work, perhaps before bed, or even in the morning. You can even take your blood pressure pre and post calming session to see if you're successful in lowering your blood pressure with that technique. In closing, when you implement these strategies to help you manage your hypertension, please allow a couple of weeks to notice a difference. You may take your blood pressure prior to beginning this program, and then every month for 3 months to track your progress to see if these strategies do indeed help you manage your hypertension. If you are taking blood pressure medication currently, then make sure you consult with your traditional medical doctor about any adjustments that need to be made if you are successful with managing this program. Meaning, if you're taking medication and you start to implement these strategies just discussed and your blood pressure starts to go down, you might need to have your medication dose adjusted to make up for that, because you don't want to take too much blood pressure medication and be hypotensive or have low blood pressure. And please do not stop taking your medication unless you are directed by your physician. So that's it. Refer to the handout provided and the other links provided to help start implementing these strategies into your life. Give yourself some time to notice a difference. And I do believe that if you do this, you will be successful in managing your hypertension. I want to thank you again for joining us, and we'll see you next time.